Overview of health, safety, and environmental systems for firefighting. Firefighters face unique challenges and risks in their line of work, making robust health, safety, and environmental systems critical for their protection and the protection of the communities they serve. This section provides an overview of the key components and best practices for implementing effective systems to support firefighter well-being and operational safety. Importance of occupational health and safety in firefighting. Firefighting is an inherently dangerous profession, with firefighters facing a multitude of health and safety risks on the job. Maintaining robust occupational health and safety systems is crucial to protect these brave men and women who put their lives on the line to protect our communities. Effective health and safety practices can help mitigate the risks of illness and exposure to hazardous materials, ensuring firefighters can perform their duties safely and return home to their families at the end of each shift. Proper training, personal protective equipment, and rigorous safety protocols are essential to creating a culture of safety within fire departments. Ongoing monitoring of firefighter health, prompt treatment of injuries, and comprehensive rehabilitation programs are also vital to supporting the well-being of these frontline heroes. By prioritizing occupational health and safety, fire departments can foster a work environment that empowers firefighters to perform their jobs effectively while minimizing the risks they face. Hazard identification and risk assessment. 1. Hazard identification. Identifying potential hazards is crucial for firefighters to ensure their safety and the safety of others. This involves thoroughly inspecting the incident scene and anticipating any physical, chemical, or environmental risks that could threaten the crew. 2. Risk assessment. Once hazards are identified, comprehensive assessment must be conducted. This evaluates the likelihood and severity of each hazard, allowing firefighters to develop appropriate control measures and emergency response plans. 3. Safety protocols. Establishing and regularly reviewing safety protocols is essential. These protocols outline the procedures and guidelines firefighters must follow to mitigate risks, ensure proper protective equipment, PPE, usage, and respond effectively to any incidents. Personal protective equipment, PPE, for firefighters. Firefighters rely on robust personal protective equipment, PPE, to safeguard their health and well-being during hazardous operations. This specialized gear includes flame-resistant uniforms, insulated boots, gloves, and self-contained breathing apparatus to shield the body from extreme heat, smoke, and toxic fumes. PPE ensemble is carefully designed to allow for a full range of motion, while maintaining the highest levels of protection. Regular inspection and maintenance of this equipment is crucial to ensure it functions properly when lives are on the line. Respiratory protection and air monitoring. 1. Self-contained breathing apparatus. Firefighters rely on self-contained breathing apparatus, SCBA, to provide clean, breathable air in hazardous environments. The SCBA features a mask, air tank, and regulator that allow firefighters to operate safely in thick smoke, toxic fumes, and oxygen atmospheres. 2. Air quality monitoring. Portable air monitoring devices are crucial for assessing the safety of an environment. Firefighters use these devices to continuously measure gas levels, oxygen content, and other air quality indicators, allowing them to identify and mitigate hazards in real time during firefighting operations. 3. Decontamination and exposure. After firefighting operations, proper decontamination procedures are essential to remove any hazardous materials or contaminants from the firefighter's personal protective equipment and skin. This helps minimize exposure and prevent the spread of dangerous substances. Decontamination and exposure control. 1. Decontamination procedures. Proper decontamination is critical for firefighters to remove hazardous substances and prevent the spread of contaminants. This involves a multi-step process of washing, rinsing, and removal of PPE in a designated area to ensure thorough cleansing and safe disposal of contaminated materials. Exposure monitoring. Continuous air monitoring and biological testing help identify and quantify firefighter exposure to toxic substances. This data informs medical surveillance, exposure control measures, and ensures compliance with occupational health and safety regulations. 3. Contamination control. Strict protocols for handling, storing, and disposing of contaminated materials prevent the spread of hazardous substances. This includes dedicated decontamination zones, proper containment and labeling, and specialized waste management procedures. Hazardous materials management. Hazardous materials management is a critical aspect of firefighting operations, as firefighters often encounter a wide range of hazardous substances during emergency responses. This section will explore the key elements of hazardous materials management, focusing on the identification, handling, and containment of these potentially dangerous materials. 1. Hazard identification. Firefighters must be trained to quickly and accurately identify the presence of hazardous materials, using visual cues, placards, and other indicators to determine the nature and risks associated with the substances they encounter. 2. Containment and mitigation. Once a hazardous material has been identified, firefighters must take immediate action in the spill or release, using specialized equipment and techniques to prevent the further spread of the material and minimize the impact on the environment and public health. 3. Decontamination procedures. After dealing with a hazardous materials incident, firefighters and their equipment must undergo thorough decontamination to remove any residual contaminants and ensure the safety of the responders and the community. Environmental considerations in firefighting operations. 1. Reducing environmental impact. Firefighting operations can have a significant impact on the environment, from chemical spills to water runoff. Firefighters must be trained to minimize this impact by using eco-friendly foams and retardants, containing spills, and properly disposing of hazardous materials. 2. Protecting natural habitats. When fighting wildfires or responding to incidents near sensitive ecosystems, firefighters must be mindful of protecting the local flora and fauna. This may involve using specialized tactics to avoid damaging vegetation and wildlife habitats, as well as coordinating with environmental authorities. 3. Water conservation and runoff. The large volume of water used in firefighting can lead to significant water runoff, which may contain contaminants. Firefighters should be trained to employ water conservation techniques and manage runoff to prevent pollution of nearby waterways and groundwater. 4. Air quality monitoring. Firefighting operations can release a variety of airborne pollutants, including smoke, chemicals, and particulates. Firefighters should monitor air quality and take appropriate measures to protect themselves and the surrounding community from exposure to these hazards. Emergency response and incident management. 1. Rapid response. Firefighters must be prepared to respond quickly and efficiently to emergency calls, deploying the appropriate personnel and equipment to the scene in a matter of minutes. Rigorous training and well-rehearsed protocols are essential for ensuring a coordinated, rapid response that can save lives. 2. Incident system. An incident command system, ICS, is a standardized approach to the command, control, and coordination of emergency response. It establishes clear roles and responsibilities, enabling firefighters to work together seamlessly and adapt to evolving situations on the ground. 3. Risk assessment and mitigation. Firefighters must continuously assess the risk posed by the incident and take appropriate measures to mitigate those risks. This involves evaluating the hazards, determining the safest course of action, and implementing protective strategies to ensure the safety of both responders and the public. Continuous improvement and compliance. Maintaining a culture of continuous improvement and compliance is essential for effective health, safety, and environmental management in firefighting operations. Firefighters must stay up to date on the latest standards, regulations, and best practices to ensure the well-being of their teams and the communities they serve. 1. Implement a robust internal audit program to identify areas for improvement and ensure ongoing compliance with relevant laws and regulations. 2. Encourage a culture of open communication and constructive feedback, where firefighters feel empowered to report hazards, near misses, and potential violations without fear of retaliation. 3. Regularly review and update the department's health, safety, and environmental policies and procedures to address evolving risks and incorporate lessons learned from incidents or industry developments. 4. Provide comprehensive training and ongoing education to all firefighters on the latest safety protocols, equipment usage, and environmental protection measures. 5. Collaborate with local authorities, regulatory agencies, and industry organizations to stay informed of new regulations, best practices, and emerging technologies that can enhance the department's safety and sustainability. With my best regards, Dr. Sam Tawfiq.